好，各位观众，大家好啊！今天很准时3点钟，礼拜四，我还来不及向大家说 greeting， 他们已经来了。今天是6月10号，星期四。昨天、前天都是书面的，每天都是第180新增的。今天也是照例先做一番自我介绍，他是我们的 Bc 省卫生厅厅长 Andrew
Dix。We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Friday, we'll be providing an update, a written update around 3 o'clock.
明天还是3点钟左右是书面通知。
Pandemic in British Columbia. On Monday, we'll be providing a further update on COVID-19, and we'll be addressing issues on Monday around Step 1 and Step 2.
礼拜一是关于第1阶段、第2阶段重启的一些问题，要重点谈一谈，所以也欢迎大家收看。同时，省长会加入这个新闻简报。那么，但是他好像没有说几点钟礼拜一，敬请大家留意我们的温哥华港湾 TV 频道。我一般都会事先提前半小时到1个小时提醒set reminder.
We'll start off with an update on our immunization and
先说疫苗
cases, and then we'll talk an update on the data that we're using and following on a
再讲
regular
一下数据的
basis.
说明。
So as of today, 74.9, not quite 75%,
差一点点
of all adults 18 and
75%
older in
成
British
年人的
Columbia have been
比率
immunized against COVID-19. 72.8% of everyone 12
72.8%
and older have now
是12岁以
received their
上
first dose. So that is 3,823,103 doses of all 3 of our COVID-19 vaccines have been administered in British Columbia, and of those 443,562
已经40多万是已经打了第2针了。
This equates to about 325,000 immunizations every week.
每天是32万，每个礼拜。
It is important to note that invitations to book your second dose will be sent after 8 weeks.
所以大家一定要记住，所有的人只有8周以后才能够收到预约的通知打第2针。
When we're starting to
这个再强调一遍。
book second doses. And at this point, given the strong demand, appointments may take 1 to 2 to 3 weeks later as we get
所以现在还要提醒大家，现在的预约还是提前了2周到3周。我记得第1针我也是提前了2周到3周。2周到3周。
in BC is connected to a single dose of vaccine, and we're using every last dose to get people fully immunized as soon as we can.
所以他也是说，我们不会有库存，我们会用尽所有的我们有的疫苗打给所有的人。所以我们现在已经强调了，避免这个疫苗的浪费，请大家预约以及注册。那么同时呢，我们每个礼拜都会收到大量的疫苗到货，然后呢，我们会马上的运输部署到各个诊所。
So we can continue
所谓的诊所不是看医生的诊所，它是这个施打的点。
We're limited still by the supply that's coming in. Thankfully, it's much more than it was.
虽然我们现在的供应量还是有限，但是很感谢这些厂商的努力，我们已经比之前的供应量充足很多。同时呢，预计到6月底之前会有很多的疫苗会来。
I would like to assure people, though, that this dose interval is well within the safe range.
所以，同时大家一定要，我向大家保证，你们现在打的第1针，同时第2针这个8周是安全的、有效的。这个因为已经有更多的证据证明，第1针打了这8周以内还是很有保护率的。
As a matter of fact, for older people, it's 3.5 times higher in one study when the interval was 11 to 12 weeks.
所以他也是说到这个。
So those are the things
3.5倍，12周以后都是比之前提高3.5倍所以12周以后都有这个抗体的水平，所以我们也是在积极的观测同时我插一句，我一个朋友他收到了这个 BC 省公卫系统发的血液采样的一个要求，也就是 观测随机检测血液里边的抗体水平。
153 new people diagnosed with COVID-19
153个新增。
Bringing the total number of people with COVID-19 to 145,996. Of the new cases, 21 are people in the Vancouver Coastal Health Region, 73 people live in the Fraser Health Region, 11 people are in the Vancouver Island Health Region, 39 are people who live in the Interior Health Region, and 9 in the Northern Health Region.
还是非沙一级阶层
73 1,910 active cases around the province.
只有1000多例是 active.
176 people are in hospital,
176个住院
49 of whom are in critical care
49个在重症监护
and 142,314
已经有 142000多个人已经痊愈了
acute infection. Sadly, today we have an additional 4 people who have died from COVID-19. One of those people were in their 50s,
一例是50几岁2例是60几岁1例是80几岁
bringing the total number of people we've lost to COVID-19 to 1,729. And our condolences go out to all of those who have lost loved ones, to their families and communities. Our thoughts are with you in this difficult time. We do have 5 active outbreaks in long-term care and
目前
assisted
为止
living
还有
and
5
2
个
in
长期
acute
护理
care.
院2个急诊型诊疗所的爆发情况 还 active 在那么今天呢会给我们一些数据的分析因为今天是6月份的第2周了
The first slide we'll present is the geographic distribution.
那么第一个页面还是给大家看到按照地理位置的阳性分布情况阳性案例分布情况
last year. And it really does show, this is cumulative, so it shows that there have been no areas of the province that have not been affected by COVID-19.
同时呢也是讲这个图里告诉大家我们省没有一个地方是安全的净土所有的地方所有的社区都会受到了这个病毒的影响特别是我们这些这个长期
The good news is this is the information about cases and case rates in the last week.
这个是黄颜色这个第2个页面呢是指上个礼拜这个都是黄颜色了越黄越淡这个越人数越少颜色越深人就越多这个是每10万个人里边的数字咖啡色最深的是10万个人里边有20个最浅的黄色呢是10万人里边是 0.1 个人到5个人之间大家可以看到基本上都是反而这个内陆在这个上面东北部是10万个人里 5.1 到10个人还有呢每家边境在那个内陆边境在这个那个产葡萄的地方也比较深这个是6月1号到6月7号所有的这个热点地区的爆发的情况第一个最高的还是飞沙第2个就是内陆第3个是北部稍微第3个高度的是温哥华这个沿岸说错了那个这个也是这个累积的案例
So that is a testament to people doing what they need to do and the immunization that we're
所以他也说了这些总体都是在下降证明了大家这个应对措施正确同时呢积极接种
Grand Forks where it is a very small population have a higher rate of transmission. But again, the positive that we see in this is that most of the rates have dropped quite dramatically in the last few weeks. This is our overall epidemiologic curve that has our cases at the top, and the middle line is hospitalizations, and along the bottom,去年2月到今年的6月7号的住院每天的新增以及死亡的这个数字所以大家看到了他说这一波最近从4月份以后极限下降这个也是这个下降的趋势还在持续所以他也是说到了这个一定就是疫苗所起到的作用Throughout the third wave, despite having the highest number of people
BC 省民是这样BC 省民的数字我不是很清楚但是 能够打疫苗的是420万，当初是18岁以上，但是现在算上12岁到18岁有30几万，所以 BC 省整体能够打疫苗的是450多万人口，现在已经382万3000多个人打了第一针，至少第一针，其中40多万打了第二针了。谢谢 Lisa， 谢谢你的鼓励啊。这个呢是各个卫生区的这个疫情的案子啊，大家都可以看到，都是在极限的往下走。同时这个是飞沙，第二个是飞沙，第三个是内陆啊，第一个是北部卫生局。他说内陆卫生局虽然绝对数字，北部卫生局绝对数字虽然小，但是考虑到他们的人口基数低，所以他们的比例还是很高，所以也是在那边传染的情况还是这样的。那么这个呢是年龄，从2020年1月份到2021年6月7号7天平均数这个绿颜色的是18到0到4、5到18、19到39岁是绿颜色那么紫色的他说是80以上的那个黄颜色呢60到79各个年龄阶段大家都可以看到是往下走的这个趋势都是打了一针以后的这个突然之间就往下走。这个是每天新增案例阳性案例的这个测试阳性率死亡率现在说的这个是比率了。那么从6.5%，然后呢，北部是7.6%阳性率那个我看看都是3个沿岸这个飞沙还不高这个呢是重症以及住院的情况，因为重症才住院以及在 ICU。 那么这个是从今年1月到6月5号，也是年龄阶段那个越深的颜色年龄越大。
Here's an updated review of the data looking
这个
at the
是重症监
distribution of
护
cases,
的这个住院的情况，大家可以看到这个咖啡色的这个死亡以及这个淡紫色的是重症监护绿色的是住院，黄颜色的是表示阳性率整个 BC 省的年龄是用蓝色，比如说小10岁的是这个人你看到吗这个10岁以下的这个阳性就很低，那么这个10岁以上的开始哒哒哒哒就高了，然后一直到了20到29岁很高，但是呢几乎都没有人住院，大家可以看到
We have been paying particular attention to school age children. So 5 to 18 years in BC,
这个是孩子学龄儿童的这个阳性案例的分布0岁到4岁 2.4%这个就整个阳性案例里边 2.4%占人口是 4.4%13岁到18岁占人口是 6.0%阳性的案例是 6.7%大于19岁的才 84%这个是重点告诉大家这个呢是我们的整个社区的
what has been called variants of concern because they may increase transmissibility in most of them at this point have increased ability to transmit between people, making it that much more challenging to stop transmission and stop outbreaks. So this is a reflection of the epidemic in the different parts of the province and in British Columbia overall. And what we can see is that the variants of concern that have been identified are now the predominant strains that are circulating in people and being transmitted across the province. Even though the numbers are very small in some places, even in Vancouver Coastal, where it's as high as 100% of them are variants of concern, the same measures that we are taking to prevent transmission of any of the strains of the virus are working to prevent transmission and to reduce the numbers of people with this infection in communities across the province. I will say that we have adapted our testing strategy, as we've talked about a number of times. We were using a screening test, but that has limitations, and it can't detect every single variant or every different strain of the virus that is circulating in the province. And as we get smaller and smaller case numbers, and as we start to open up more and people are traveling more, it is more and more important that we know exactly which strains of which virus are circulating where. And to that end, we've now moved as of a couple of weeks ago to doing a whole genome sequencing on 100% of our cases in British Columbia. So what we know exactly which strains are infecting people across the province, and we have the capacity in our lab to do that. We've done close to 33,000 whole genome sequences since the pandemic began, and it has helped us in understanding how outbreaks have been transmitted, whether there's variants that are causing clusters or outbreaks in workplaces and long-term care. And now every single case, we are able to determine exactly what strain is circulating. And this is a summary of the relative proportion of just the variants of concern that have been identified by the WHO that are in our province over time, with the bar on the far right being the week of May 3rd to June 5th. And we can see that the predominant strains that we're seeing circulating are what's now called alpha and beta strains, the delta. The WHO is supposed to make this easier by switching to Greek names, but it's the alpha and gamma that we have most commonly here in British Columbia. So the P1 and the B1.17. And we have seen some geographic variation with the B1.17 seen more commonly in Fraser Health and P1 in Vancouver Coastal. But all of those are coming down. This is the proportion of the strains that we're seeing. The beta, the one that was originated in South Africa, we did see some of that circulating in BC, but that has mostly been contained and controlled by the measures that we took to prevent transmission and, of course, by protection from immunization. Right now, we are seeing some transmission with people infected with the Delta strain, but it is a small number and a small proportion of the cases that we're seeing on a daily basis. And on the BC CDC website, you can look in detail at all of the different strains that we're seeing circulating in BC. There's about 14 other additional strains that we're watching and monitoring with whole genome sequencing, ones that have mutations that we want to be able to understand if they're being transmitted in the province, and it includes strains that were identified in New York, California, in Brazil, etc. So this is going to be more and more important for us as our case numbers decrease and as we have more people moving around the country, the province, and eventually internationally to understand exactly which viruses are being transmitted between people is how we detect whether a new strain that might have some other advantage, whether that means vaccine doesn't work as well, or if it transmits more easily or causes some more severe illness. So this is an important role that the BC CDC will be doing and has been doing in BC, and will be linking with whole genome sequencing from across the country. I know there has been some concerns that we're not detecting all of the strains that are circulating, and that things like the Delta strain could be accelerating and we're not able to detect it. Here in BC, with the strategy that we have for testing and with our lab being able to have the capacity to do whole genome sequencing rapidly on all cases, means that we are in a good place to monitor this carefully over time. So finally, to go on to the other important part of our program, our vaccination progress, and this is the dashboard summary in one slide. Up on the right, the dial indicates the proportion of people with first doses, which as of yesterday was only 72%. As I mentioned, it's up to 74.9 today. And our second dose is up a little bit above 8% now. What we call a population pyramid on the left-hand side gives you an idea of the size of each age cohort and the number of people who've been, or the proportion of people who've been immunized with the blue being first dose and the green being second dose. As we can see, that is increasing, starting with our older age groups and moving down through to 12 to 17-year-olds, now having a good start on getting up with first doses. We also see that it's not equal across the province, and certainly in some areas in northern health and in interior health, we're having more challenges in reaching people, and we're taking different strategies to make sure that people have access to vaccine across the province. This is another summary which shows the trajectory of how people, the progress in immunization percentage by age across the province. And what we can see is as people became eligible in that age group, we had increased rates of immunization, and then it leveled off somewhere around 80%. One of the things that we are seeing is in the younger cohorts, that leveling off is happening a little bit earlier. So we're doing more targeting towards younger people to make sure that they are getting immunized, especially with first doses in the younger cohort. And then at the very end, the 12 plus is the summary of how we're doing with immunization across the board. And to put that into context geographically, this gives a sense of the vaccine coverage by local health area for people 12 and above. And we'll note the lightest colored green is above 50%, so everywhere in the province we've reached 50% coverage for people 12 and above. But in some areas, that is much higher. And the highest, the darkest green, is 80%. And it's really great to see that in many areas of the province we've reached 70 to 80% in coverage in people 12 and above. And if we look at this same information for people age 50 and above, even more areas of the province are covered. But this does tell us there are some pockets where there's still more work to be done, both to encourage people to be immunized and to make sure they have access to vaccines, particularly in the northeast, in some parts of the central Okanagan and the Grand Forks, Kettle Valley area, and of course in some parts of the lower mainland, particularly in Richmond area.
本来呢，7月1号是按照第2阶段开，7月1号以后 BCLC 赌场可以开业。所以请大家留意礼拜1，省长也回来和他们2位一起，3位共同宣布，第1阶段是不是结束？因为按原计划，6月15号第1阶段，6月15号以后第2阶段。那么数字上来看，现在接种率已经超过了原定的第1阶段的第2阶段的重启的数字，但是他们一直在说，他们不看日期，只看数字。还要看其他的数字，所以他们才能决定第2阶段、第3阶段重启。那么7月1号呢，应该是第3阶段重启。第3阶段是比较长，一直到9月份，好像是我印象里边。那么可以肯定的是，如果按照计划来讲，7月份赌场是重开的。这个也是告诉这位网友。所以礼拜1很重要。省长也回来跟他们2位一起给大家宣布这个第2阶段重启是不是如期执行。现在看来应该没有悬念。
And we use that information to help us understand what could happen next. And so this is the dynamic compartmental modeling with some projections of what can happen, what could be ahead for us, given what we're seeing in terms of transmission in our communities and immunization rates. And this also is a good news story. With the measures that we've been taking and slowly getting through this last step one of our restart, what we are seeing is that, yes,
虽然是比人家高，但是它还是在往下走，还是往下走。所以就说你疫苗还是要打。
More cases arise, but they're not going to be widely transmitted in our communities the way that we have seen before. Like we saw in March, where we started to see rapid exponential growth, because we still didn't have enough people protected to prevent those transmissions from happening, and we were having contact with larger numbers of people. So we are confident now that with what we're seeing, with the immunization and protection that we have in our communities,
现在到80%了，几乎回到了正常的社交生活。但是呢，你随着你都是在80%的接种率这个前提下，到了9月份，就是还是要往下走。那么大家如果要选择70%的这个社交层面恢复到正常社交的70%的，那么几乎就都往下走了。
To stop transmission
不客气啊，金城少爷应该说是没有悬念，因为呢BCLC 呢他们有一个公关的文章，上个礼拜本来应该是要发布，但是呢后来没发布，也是关于重启的这个事，因为考虑到怕有很多人误解，因为按照这个卫生厅以及卫生官的这个宣布的计划，不是日期，而是看数字，所以呢他们这个公关的文章呢就不能发，他们说是7月1号开，那你这个计划是7月1号开，但有可能这个数字到时候没到呢，7月1号就开不了，所以这个问题，但是应该说是没有悬念。所以他也是说，对我们来讲，每一个人最成功的关键第一就是一定要阻止这个病毒的传播。我也感谢对大家每一个人的感谢支持也请大家每个人再继续做好自己分内的事，也是要同时呢，也要让自己免疫起来，积极去打免疫针。疫苗针已经16个月了，我们每一个人的点点滴滴的努力通过的每一个保护措施。所以呢，现在呢，随着疫苗的扩展呢，每个人都开始打了第一针了。所以这个呢，使得我们的生活每天都在进步，点点滴滴的。所以我希望大家能够继续努力做正确的事情。所以这样的话，我们呢能够使得更加安全，同时呢，让我们的限制令逐渐取消。
Step 2 is coming up.
那么同时呢，他说第二阶段重启呢，马上要重启。我们呢希望大家相互支持，我们一定会达到第二重启阶段的这个目标。所以希望大家能够慢慢恢复，同时呢，能够增加一些社交，同时不要忘记我们的卫生措施。用你们的对生活的热情来保护每一个人，保护我们的社区。同时我们也意识到这个传播是一个这个缓慢的这个快速的过程我们只能是小心谨慎逐步的减轻这个禁令。所以我也知道每一个人都希望能够快步的回到正常的生活状态。
And that will help us put the pandemic behind us. The vaccines that we have here in Canada are safe and effective. One of the major side effects that they have is hope, optimism, and a brighter future ahead. And let's also remember that we can get there by doing what we have been doing all along, by being kind, being calm, and staying safe. Thank you.
容忍客气以及安全，谢谢大家。这个说得很好，这个首席医官真的不是白当的这个礼拜一他们也来是 Dr. Gutson 也不错，是他的副手写的 statement 就远不如他干巴巴的这个，所以呢Dr. Bonnie Henry 这个中学的语文一定很好很好。卫生厅长也是代表省长以及卫生厅，对这个24小时里边失去了4位生命的家庭和亲属表示诚挚的哀悼。所以他说也是大家可以看到，每次看到生命的失去啊，都是觉得人生的艰难。那么，所以也是对那些护理员工以及家庭表示诚挚的慰问。同时大家都已经看到了这个每天新增的数字都会这个下降很多。那么现在呢，已经是153个了。那么住院人数呢，已经下降到176个，其中住址重症监护呢只有49个人。所以这个呢。是马上已经从我们的医院的繁忙程度已经看得出来，已经我们的医疗资源已经控制很多，使得我们能够接待更多的非新冠的。那么昨天呢，已经有6900多个人来访问我们的急诊室了。这个已经是平时最高水平的一种了，说明我们的医疗资源也保护起来了。同时呢，大家也有信心来医院来看病。
24.3% higher than they were on March 9th, 2020, which was before the declaration of the pandemic.
那么他也是说到了3月9号，2020年的这个最高峰的时候啊，那时候很可怕。我记得那时候也是几百个人住院，所有的医生啊、护士啊，是真的是严阵以待。那时候的新增案例根本不如现在，但是那时候住院人数的确很高，真的是很严重，真的很有挑战性，所以他们。都把
I wanted to just note as well that yesterday 73,345 more people were vaccinated. Just to give a sense of that, 54,600 of those doses were the Pfizer vaccine, 10,735, the Moderna vaccine, and 8,002 in our pharmacy system were second dose of AstraZeneca. In addition to that, if you look by age group, and we saw some of this data in Dr. Henry's presentation, that we're also seeing some significant progress in second dose immunization, which is actually, and if you look at by age group, 88% of those 70 and above have received their first dose, 24% their second dose, 60 and above, it's 85% their first dose, 17% their second dose, and 50 and above, 82% first dose, and 14% second.
24的人已经打了第2针了，那么也就是说，所谓的2针呢，就是他们英文叫 fully vaccinated 我们现在不是 fully， 我们打的第1针就是 half。
And 18 and above, it's 75% first dose and 10% second dose. So, in short, we're making progress in all of those areas, and we're focusing in on what's sometimes called the ground game of communities which are somewhat lower for first doses. As you noted in the Northern Health Authority, because we distributed vaccines fairly equally across the province. Second dose vaccinations are higher in the Northern Health Authority, but we're very focused on ensuring an increasing number of first dose vaccinations everywhere. Everyone, you will know as well, and you've heard from the federal government that we're expecting, although this hasn't been guaranteed, we haven't received shipping dates, so they're not integrated into our system yet. We're expecting more doses of Moderna, and that is good news, and we'll have more to say about that next week. On Thursday, we typically report on surgical renewal, and I want to say there's good news that all 9 Metro Vancouver hospitals are now back to full operations, all 9, in our surgical renewal update this week. You may recall that last week we reported that due to an outbreak at Richmond Hospital, we had to delay the resumption of non-urgent scheduled surgeries until June the 14th through a remarkable demonstration of care and of effort of all involved, and by carefully balancing inpatient and day surgery, Richmond Hospital opened all its operating rooms on June the 7th. all of them. I also want to update on the situation at Kelowna General Hospital. On June the 3rd, we announced the outbreak there, and through a similarly inspiring effort by everyone, there have to date been no impacts on surgeries. The surgical teams who have managed through this pandemic across all our health authorities have never wavered from their commitments to patients or their dedication to giving patients the care that they need. And with that, here's this week's report. From May 31st to June 6th, no surgeries were postponed in the Fraser, Vancouver Island, Interior, Northern, and Provincial Health Services Authority. Due to COVID-19, 93 surgeries were postponed in the Vancouver Coastal Health Authority. This is the week from May 31st to June 6th. That said, well, we expect that we will report a small number of further postponements next week because some surgeries were shifted to balance the surgery types. We expect no further postponements due to the third wave, and that is a welcome result and a relief for so many. And therefore, fortunately, this will be the last time I'll be reporting on it. Still, this means that 2,399 surgeries were postponed from April 19th to June 6th. From May 24th to May 30th, health authorities completed 6,048 surgeries, of which 4,618 were scheduled surgeries and 1,430 were unscheduled surgeries. You recall that was the day of the May long weekend. And so typically in those weeks, which are 4-day full weeks, there are fewer surgeries postponed, a similar number to last year. By health authority, that's 1,610 in Fraser, 1,158 in the Interior Health Authority, 333 in Northern Health, 1,382 in Vancouver Coastal Health, 1,313 in Vancouver Island Health, and 252 in the Provincial Health Services Authority. The third wave brought new challenges to our delivery of non-urgent scheduled surgeries, but our effort to learn throughout our pandemic and our strength at adaptation every step of the way played a critical role in getting our operating rooms back to full steam safely and rapidly. Patients who had their surgeries postponed in the past few weeks are, I think, in the very best hands, and we are moving just as fast to get you the surgeries you need. The achievements in surgery report today, I think, should inspire all of us. For those in need of surgery and those whose surgery was postponed, I hope the feeling is one of relief, of renewed confidence, of certainty that soon things will be better. And for the rest of us, I hope the inspiration is just as personal, to keep going, to keep playing our role in limiting further outbreaks that impact surgeries and cause heartache to those in need of them, to keep registering, booking our appointments, and getting our first and second doses, to keep using our COVID skills every day, to keep following the guidance that keeps people healthy, and to keep adhering to the public health orders that stop the spread, to keep doing our essential work to ensure that those in need of surgery get the surgery they're counting on, so that they are part of our growing achievement in giving COVID a smaller, less intrusive role in our lives, in all那么刚才波尼医生说好了，就是第二针的预约还可能是有2-3个礼拜。我记得我的第一针预约是2个礼拜，就是我预约的是要2个礼拜以后。那么有些人呢说要看运气，因为有些地方点。
Dr. Henry, you're making it pretty clear here, especially with Premier Horgan joining you, that we can expect to move to step 2
这个也是说的第二阶段重启啊。你说很有把握，礼拜一就是开始期望第二阶段的重启。
The plan is vague in some regard.
他说你的计划第二阶段和第三阶段的标准有点模糊。这个包括这个住院的人数啊，重症监护的人数啊，包括你刚才提到了有些地区社区这个传播还是有点严重。
And it is a little bit vague. We say cases are low, and that recognizes that as we get down to low numbers of cases, that even a small increase, a small cluster of cases will mean the numbers go up a little bit. But that's okay. What we need to focus on is, are there small enough numbers of cases that we can manage from a public health perspective, the same way we would any other reportable communicable disease. So making sure that public health that we can get access to testing rapidly, that we follow up with cases, that we manage manage to stop transmission to contacts, and that we can manage those over time. So even rather large cluster, as long as we can manage it through public health activities, we are keeping people safe in communities. And so that's why it is intentionally a little bit vague. So there's no specific number that we are looking at, but it is around finding that balance of reducing transmission as much as we possibly can and getting people protected as much as we possibly can. And we still are in a bridging place. I've been using that term bridging, I guess, from as we started in the restart. We're not in a place where we can fully take away all of the things that we've been doing to prevent transmission. But we're getting towards that. And part of it is because we have safe and effective vaccines, and part of it is because we are reducing the numbers of risky contacts we have and getting tested and making sure that if we're sick or around somebody who's sick, we stay away from others. So all of those things will continue to be important in the next few weeks as we move into July. And then we need to start gradually moving from having orders to having that guidance that we use on a day-to-day basis to keep ourselves, to stay away from others if we're feeling unwell ourselves, to get back to this being learning to live with COVID and recognizing that it's not going to spread widely in the community the way it did even a few weeks ago.
Richard, do you have a follow-up?
I do. This is for both Minister Dix and Dr. Henry. There's been some criticism that BC doesn't have any new safety measures in place for long-term care when it comes to the reopening. In Ontario and Quebec, they've made full vaccination mandatory for long-term care staff. If they refuse, there are steps they have to go through. Why won't BC make staff vaccination mandatory in long-term care? And is there consideration being given to making vaccination mandatory for visitors, unbidden visitors?
是不是我们也要做这么 BC 省也有这个规定
revised our visitation policy and put that in place.
我不知道各位观众有没有家里边的人在长期护理院我家附近的长期护理院夏天我是看到这些老人可以看望自己的亲人都隔着一个窗冬天下雨我就觉得他们挺可怜的我也没办法看他们怎么探望的
At the same time that we were putting in restrictions in the community.
所以他也是说到了我们也是做了各种各样的准备也是限制措施也在不断的调整也是根据这个数字也是落实一些限制措施也是逐渐开放
both on an individual level but also how it affects facilities
因为在疫苗刚出当初的时候在1-2月份的时候好像有些长期护理院的指定的探访人也允许让他们打疫苗
most residents being immunized and most staff. So yes, we are revising that. We're looking at the policy. We have still in place a single site order, and as part of moving forward into the next phase of this, we will be looking at how do we ensure that everybody in these most highly vulnerable settings are immunized with 2 doses as much as possible. So those are things that we're working on currently, and yes, it's incredibly important and it continues to be incredibly important that we do that immunization in long-term care for everybody who's going into a long-term care home
对那些长期护理院的人居民以及这个护理员工做一个强制性的疫苗措施我认为这个也是很重要的那么这个呢也是卫生厅长要去回答这个问题了这个 Richard 是 Vancouver Sun 的一个记者我是觉得这个记者西方的记者一定起到了这个作用就是为民发声因为他们的媒体的一个一个大的作用就是对政府的监督对公共事业的监督这个是很大的一块
a number of weeks ago in late May, but what we're significantly looking at at all of the issues, to discuss issues around vaccination. And I would say that 33,219 residents have received their first dose in long-term care, and 28,703 residents their second dose. 41,496 long-term care staff their first dose. 27,755 their second dose. So we're looking at all of those questions, including further revisions to visitation. The long-term care issue, we were at a different place, and I think the changes that were made in visitation on March 25th were the right time to make those changes, the safe time to make those changes, and the impact of those on the quality of life in long-term care have been profound, and we're going to continue to revise and adapt to ensure to increase, we hope, access and the openness of long-term care so that people can engage in the social activity that's particularly important in long-term care, and at the same time continue to revise measures to keep everybody safe. So you'll be seeing action on that soon. It's not, as it wasn't in March, it's not directly related to the phased easing of restrictions that we saw starting at the end of May, in which we're considering in terms of a new step now. Final thing I'd say is this, that the measures that are in place are the measures that are in place. And I think that British Columbia's support a step-by-step approach.
到了80%以上的省民，大家都打了2针以上了，每天的新增案例上到个位数了。我估计他们的这个新闻简报也不会1星期2次了，估计就1个月1次啊，半个月1次了，也可能是这个阶段。那么我们就看我们还会有些什么大家关心的议题，我们做一些新闻简报。所以下个礼拜一也是比较重要的，所以省长也会贺锦省长就会给大家跟他们，这个是 Global Mail 全球邮報的一個記者。
Is there a chance that you will look at mandatory vaccination for care home workers?
又是提到这个问题，就是强制疫苗那些长期护理院的员工必须是要打，强制打。你有没有可能他说绝对这个各种各样的方式我们都在考虑所以
residents in long-term care are protected to the fullest extent possible, and that is part of that. It will be ensuring that people who work in long-term care are immunized. But there are a number of different factors to consider around that. So it is access to vaccine, protecting doses, and what other measures need to be in place for people who for whatever reason are unable to be immunized. So yes, we are actively working on all of those in terms of the progression of the policy for workers in long-term care.
这个很好，这个的确我们想不到。
I do, thanks. In a similar vein, so we're talking about these restart phases next week and through the summer. I'm just looking ahead to the fall and wondering what needs to be done in terms of preparing for that and the potential for resurgence of COVID cases.
也是说到了第二阶段的重启，
any kind of plan underway for
现在看到了有潜在的因为印度变异体的这个爆发，有潜在的一个峰值要出来。你们有没有看到？有没有这个预防？同时呢，今年秋天的到。你们有没有准备？因为秋天一般都是呼吸道传染病的高发季节。
The pandemic mode that we're in and into living with COVID, and that does mean that we will need to monitor and understand the transmission of this virus as we go into our normal respiratory season next fall. So what does that mean in terms of surveillance and testing? What does that mean in terms of being able to detect and manage outbreaks in schools and long-term care homes?
同时呢，检测要跟上那么一定要有这个设备来检测病毒的种类到底是流感还是新冠病毒等等。同时呢，学校也是，那么对这个各个林业场所都是这样一个保护。
Like we do every year
所以就像我们每年 注射在流感季节，我们做的措施都是一样的。
Before we understand exactly how COVID is going to evolve, but we can expect there will be transmission.
那么现在呢，我们也是对这个新冠病毒的进展、他们的进化不是了解很清楚，但是呢，我们清楚它们的传播途径我们也知道它的特性，所以我们现在都要在防疫方面都要做的走前一步，能够使得各个地方、各个场所都能够事先保护起来、建立起来防线。
That we will have to take those across the board, very severe measures that we've had to take to get us through this last
那么同时呢，为了这个
But it'll be more focal.
那么还接下来的几个礼拜呢，是很重要的，就是因为过去了16个月来我们大家所经历的，所以我们还要考虑到那个开放美加边境这个带来我们更大的一个挑战所以我们要加强测试，要加强各种卫生措施，事先预计考虑到各种各样的措施都要，特别是检测跟上。所以因为主要问题就是这个新冠病毒的防护措施和流感的防护措施基本上是差不多的，所以我们只能是继续一个呢是要加强通风减少的这些传播还有呢我们的学校我们要加强他们的
children and staff in
教职员工孩子们
让
他们能够回到正常的工作状态这个都是我们要考虑要做的，如何加强防疫、加强测试。那么卫生厅长也是在对长期护理院。也是因为其他的几个省都是做到了强制让护理员工打疫苗的这个命令。
long-term care workers as part of a plan we introduced last September. Part of our fall and winter plan that was to continue on over 3 years. 因为这个疫情来了之后呢，又额外招聘了7000名长期护理员的员工。为什么？大家知道，因为原来呢，一个护理员工今天在这儿做，明天在那儿做，现在呢，不让他们窜来窜去了。现在的政策叫 single site， 就是说一个员工只能在一个地方做。那么这样呢，就造成了护理员工的大量短缺。所以他说，去年到现在呢，额外招收了7000名护理员工，那现在全省有4万多护理员工就是这么，所以这个费用开支很大。还有去年也是说到了给他们这些护理员工的那个加这个奖金，因为他们很累这个 bonus 作为鼓励都是给了，都是省拨款。 Coincident with the pandemic, in some cases advanced by the pandemic, continue on. And in addition, of course, we've achieved our goal of meeting the provincial standard across health authorities with respect to the staffing and care standards in care homes. And as you know, 85% of care homes didn't meet that standard 3 years ago. And that's been changed, and that made a big difference throughout the pandemic.
Next question, Shannon
他
Patterson,
也是说到了，
CTV.
通过这次疫情呢，3年前这些85%的护理院呢都没有达到一些标准，那么现在都达到了，就是因为这次疫情加强了。
Can you tell me what you think is happening in Richmond? And also generally, what is the message for those who have yet to get a first dose? And how is BC encouraging them to do that?
Yeah, so we have been obviously looking at this in some detail in many different communities. So we're, Dr. Ballum calls it our ground game. And so we've advanced that in many different fronts. So that is connecting with community leaders, connecting with faith leaders, connecting with other parts of where people are in different communities to bring vaccine to them. We know that most people are doing the right thing and getting on board and coming to the clinics, but for some people it's more of a challenge. So in the interior, we've been seeing mobile clinics going around to smaller smaller communities where it is more difficult for people to access one of the standing clinics. We've also seen the easy clinics popping up in and around Fraser Health and similar things in Richmond. There's been work done with Vancouver Coastal working with different community groups to basically spread the word and make it easier for people. And I've talked about this before. We know that we reach a certain level and then we have to take different strategies to reach people. And there's a couple of different things that are of the concern. Sometimes it's complacency, and that certainly is a factor in many of the more rural communities where there's not a lot of transmission and it takes a great deal of effort to go out and actually find a vaccine. So making it easier for people, understanding that it's not just protecting you, but it is protecting us all, making it convenient. And the other one is having confidence in the vaccine. So those are all things that we're working on in different areas of the province, and there's all kinds of innovative things that are going on in different places.
社区啊，那个发明了不同的方法来鼓励大家来注册。
The people of Richmond, our MLAs who have been incredible leaders.
那么他也是卫生厅长嘛，要做政治正确嘛。他也感谢省议员在 Richmond 的省议员帮助延安卫生局一起做这个居民的疫苗注册工作。那么现在呢，Richmond 的列治文的这个疫苗注册明显上升了。所以我也感谢每一个包括媒体在列治文的这个疫苗推广方面做出的贡献。
We're going to do the same kind of things across the province. For example, the first dose immunization clinic in Cherryville at Frank's Grocery. The fact that there are BC CDC nurses, a number of them since the beginning of June in Fort St. John, 4 more coming next week to increase the number of immunizations. And we're doing lots of work with we're going to be doing lots of work with the mayor in Dawson Creek and in Fort St. John on those questions. So we're going to go step by step and increase those immunization rates everywhere. That's the plan, to work with communities and to support communities. And I think these are good examples. A number of weeks ago you saw UBC very low in terms of immunization as a community health service area. UBC has a lot of young people, and this was an age-based process. Well, you've seen now that number come significantly up, but in terms of registrations, it's above the provincial average. So I think that what we're seeing is that work getting done everywhere in the province, and we're just going to keep working with communities to raise those levels. It's as important in Surrey and Delta and Richmond as it is in Fort St. John and Dawson Creek and Cherryville. And we have to continue to do that.
Shannon, do you have a follow-up?
Yeah, I mean, the news today is incredibly positive. The reproductive number being where it is, even the worst case scenario projections are so much better than anything we've seen. Dr. Henry, what could undo this? Is there a scenario where this could all go sideways? And what would have to happen for it to go sideways? Would it have to be an explosion of a variant-resistant or a vaccine-resistant variant?
You know, these are the questions that keep me awake and make me anxious every time I look at our case rates and our case numbers and the modeling when it comes up. It is very reassuring. We are in a different place, and it is because, I'm not given to hyperbole, but because these vaccines are so good and they work well and they last, those are the things that we had all of these questions about. And as time goes on, we're seeing what's happening in other countries. We're seeing things like the fact that the antibody response is stronger and lasts for 3 months, 6 months, and that interval that we have, that we made that decision to get first doses into people as quickly as we possibly could. We're now seeing that delaying the interval by as much as 12 weeks actually gives people a stronger, longer lasting effect. So that means that will last us through hopefully next fall, next respiratory season. So these are all the things that we're learning as we go, and it is. I am optimistic in a way that I've not been for a long time, and it really has to do with how well the vaccines are working and working over time. And yes, we are concerned about the variants, and that's why I spent quite a bit of time talking about whole genome sequencing and how we are watching every single strain in every single case. And remembering, of course, that it's not just a variant that's out there, it's a person, and it's a person who's infected with a strain of the virus. And we need to watch those. Every time the virus replicates, it changes a little bit. So we could potentially have a strain arise here that has a mutation that means that the vaccine doesn't work as well against it. But that probability goes down and down and down quite dramatically when we reduce the number of people who are infected. And then if we have an introduction, we can stop transmission from that introduction. So yes, we are in a good place now. We need to get our cases down as low as we possibly can before we head into the fall, because we know that there's going to be more virus circulating, whether it's COVID, whether it's influenza, RSV, parainfluenza,
现在积极在打这个辉瑞，所以现在调一查下来，反而辉瑞加上阿斯利康加起来反而有效率会更高，特别是对变异体。所以英国现在在积极的与印度变异体在比赛时间，打第二针在比赛。
There are going to be variants that arise.
所以他也是说到了这个问题。
And we saw that in India, for example, in Brazil, in the UK.
巴西啊，印度啊。
So it's kind of a long way of saying we need to keep our eye on the global picture. We are in a good place now to slowly start moving ahead, as we can see from the modeling that we've been looking at. But there are always curveballs that can come, or as I think Lisa Hughes said last week, bricks to the head. So we are preparing for those. And part of the things that we're doing to prepare is making sure we have public health resources to do adequate contact tracing, that we have the public health lab resources to do whole genome sequencing on every single case, so we know exactly which strains of the virus are infecting people in BC as we go ahead. So those are the things that we'll be watching carefully.
Next question, Marcella Bernardo,
所以我们也是在前瞻性的ahead， 就是先看到我们这个接下来要做怎么做，所以这个媒体就要这个作用，就是要起到一个监督作用，要让他们觉得难看，要提醒他们。
How close are we to vaccinating children under age 12, considering that if that fourth wave happens,
那么这位记者问的就是说，12岁以下儿童的接种的问题来应对第四波因为现在怕印度变异体。
We were just talking about earlier today. We know that Moderna has now submitted data for children down to age 12.
他说莫德纳12岁以下的3期试验的数据已经交给了美国的 FDA。那么加拿大也会，只要美国的批准的话，加拿大也会马上就会批准那个12岁以下。那么我们都在研究莫德纳和辉瑞对6个月大到12岁。那么上个礼拜辉瑞已经给了报告。
needed in different age groups, and so they found that it is just as effective to have a half a dose, so it's 30 micrograms in the adult dose. They're looking at doing
30毫克
sorry, 10 micrograms in age down to age 6, and then I think it's 5 micrograms. I have to check my notes, but anyway, smaller amounts in younger age groups. They've started the studies in those younger age groups. Their expectation is that we'll have information on immunogenicity and on safety probably by end of September, October, but before the end of this calendar year. So there is potential both for Pfizer and Moderna to have that information, to have vaccines available for younger people, probably before the end of this calendar year. Having said that, there's also some really good data that shows that for every 20% increase in immunization in adults 18 and above,
20岁以上
even if you
18岁以
don't
上的
immunize children, they are protected. In Israel, some of this came out of Israel.
每个年龄阶段往上涨20%这个保护率 那么也就是说年龄越大保护的越好
So that's important to know as well. And it reflects the approach that we've had where it protects everybody. The more people who are more adults who are immunized,
所以他也是说，只要是成年人尽快打第一针成年人打了第一针了之后，整个社区的传播率就会下降，那么孩子们也就会保护了。那么这样的话，整个社区的传播下降了。所以这样的话，成年人他说是很重要的，成年人的第一针很重要。他包医生始终强调，打第一针和打第二针的区别。打第一针主要是让社区保护起来让社区建立起一个防线，而打第二针呢是让每个个体身体里边的这个抗体能够持续时间长，抗体水平高。
The proportion of our population that are children under the age of 12 is about 11%.
那么他说我们整个省的人口呢12岁以下才11%，
and low rates of transmission in the community that is
所以我们只要是把
even without
成年人这个免疫保护好了，那么12岁以下的孩子们也会能够保护起来。就算是没有疫苗。
imperative for us to protect healthcare workers and adults
所以呢，也要对那些护理孩子的老师都要保护起来，包括还有其他的国家，还有环球都能够打了。那么这样的话呢，就开放起来了。现在看来呢，美加欧洲都可以，只要是大家每个国家的免疫力都差不多接近了，那么相互之间就会开放。中国开放。
clinics 24/7. So as we see more Moderna vaccine and more Pfizer vaccine being made available, are you planning to make that standard across the province that we could see in one weekend having a clinic open 24/7?
We could, you know what, this is things that we're doing on a local level. So each health authority is looking at where their communities are, the strategies are slightly different depending on where your population is, and it may not make sense in a, in Penticton to do a 24-hour clinic. It may make more sense to do a clinic at the farmers market on Saturday mornings, something where a lot more people go. So there is different strategies in different communities. That's one that works, particularly in urban areas where people may not be able to get off work. I know there's all kinds of things that people are looking at. Some of the ones in interior in the north where we have mobile units that are now driving to different communities and setting up shop, and I understand there was cake and cookies and things available for people, and a number of these that were quite popular as well.
所以各种方法都让人尝试，主要是目的是让人打。因为现在呢，他们主要是加强注册，而没有说提供给施打方便。
We're delivering vaccine every week that comes to us at the end of last week.
所以卫生厅长也是在补充就是我们每周到货很多很多，礼拜天都到了，礼拜一就马上发布出去。
So the idea that we could expand capacity that will happen concurrent with getting more vaccine and finding different ways to deliver it.
所以我们已经看到了不同的方法，能够通过物流到很远的地方去，主要是偏远的特别是这些St. John 啊、Fort St. John 啊这些很远的地方因为那些还有这些工地啊、矿场啊。等等这些特别还有米信啊特别因为有些地方上班的地方很远每天还要上班，都要到温哥华来上班所以我们的诊所施打点都要开到他们那边去付出我们的员工也是付出了额外的努力。
to those clinically vulnerable, to our elders, to indigenous
能够
communities,
让
to
更
small
多的
communities
年纪
in
大
whole
的
community
人
approach,
社
and to
区小
deliver
社区
every
的人
week
都能
the
打，都
vaccine
要
to
考虑
people
到
arms that
他们
arrives
这些因素
in
给
large
他们打。
quantities on Mondays, Tuesdays, and Wednesdays is a really extraordinary achievement done by British
所以他说
Columbians
本周
who
1啊
deserve,
2啊3
I think, our
都
gratitude.
做了格外的
We have time
付
for
出
one
了
more
格外的
question.
努力，
For
所以
everyone
取
listening,
得
Dr.
取得
Henry
了
and Minister
很
Dix
好的
have
成
released a
绩。
statement this
我
afternoon
这个
with
的
the
确
latest
是
information
这
on
个不是谦
vaccinations,
虚的。
cases,
6
and
月7号我记
hospitalizations, which you
得
can find
他
at
说是363
news.gov.bc.ca.
接种，
Final
到
question
了
to
6月
Tanya
10号才
Fletcher,
3天
CBC.
呢。7号、8号、9号、10号
Yeah,
3天
Dr. Henry,
已
some
经
people who got an
382万了，
mRNA
也就是说
vaccine want to
20
get
万
the same
，3天20
mRNA
万，真的是
vaccine
不
for their
容易，
second
真的
dose.
不容易。
Can anything
我
be
们
done
不
to
能
make
说，
sure
因
people
为
who
我
are
们
able
BC
to
省
book
也就是
appointments
这么点大，
specifically
人
for
口
the
才
vaccine
400
they
多万
first
，450 万
received?
可以
Could the
打疫
system
苗
be
的人口
updated。to include information about whether Pfizer or Moderna is being offered at the clinic at the time of booking, or should people just
这个是
consider the
CBC
two
的记者，
mRNA
他老师
vaccines
最后一
as
个问啊。
interchangeable?
第二个问题是问法语。
The bottom line is we have good, strong support that these vaccines are interchangeable. And it's not possible for us to on a day-by-day basis, it's as we said, it's a just-in-time system with high volumes of vaccine arriving to clinics on a day-to-day basis, and it changes very frequently depending on which shipments come in. And the challenge has been Moderna, quite frankly, in the last little while. So it is trickier for people who receive Moderna first to get to be sure that they're getting Moderna, but it should be easier. We're hopeful that later on in June where more Moderna is available, and our goal is to have both products available at all of the clinics. And so that is what we're trying to achieve. It's not always possible right now just because of there have been the volume of vaccine, the volume of appointments, and trying to get things continuing, and our system is not able to do that on a one-on-one basis, unfortunately.
6月底莫德纳会大量到货。
Yes, please. And if we could get an answer in French from my colleagues from Minister Dix, thanks. You mentioned we'll be transitioning from pandemic mode to living with COVID mode in the fall. Can you elaborate on what that looks like, for example, in terms of daily case numbers in BC? Like, are we talking 100 cases a day, 50, 10? And how will management of the pandemic change, practically speaking, on a provincial level?
Yeah, so from a numbers and data perspective, it will be more, we expect it will be more like how we manage influenza and RSV, which means we look at things like how many cases are we seeing in a week, that we have sentinel surveillance set up so that we can detect it when it's in a community. Recognizing that as rates are going down, we're going to have small numbers and hopefully no COVID in many communities over longer periods of time. So we want to be able to detect when it comes so that we can tell people that, yes, there's some COVID circulating, as we do with influenza every year. And then people need to take certain measures to protect themselves and to get tested and things like that. So we are working on that. How we see it is that this virus is going to be another one of those respiratory viruses that at least for the next few years we're going to have to pay attention to. And that means in some communal settings, particularly long-term care homes, we'll need to have our outbreak management and our outbreak plans updated, and people need to be able to rapidly test, and this is a place where we have rapid testing for influenza and long-term care. We would have the same thing for COVID, and we would have an outbreak response if it was detected. So these are all the things that are, this virus is going to be with us. We know that, but it's not going to be able to spread widely. When you're in a pandemic, it's because everybody in the society is susceptible to it, and we've seen how devastating that can be. But what we see, and we can see it already in the hospitalizations and deaths, is that as we protect people with immunization, those go down, and that means we can manage this in the community like we manage other respiratory infections, like we manage pertussis, like we manage measles outbreaks occasionally, like we manage other things. And with public health working with you, being able to stay home if you're sick, keep
他也是说到了我们的社区的护士啊，也是在帮助你们协助你们如果不舒服了，那么就待在家里自我隔离。所以这样的话呢，我们还是要往前走，接下来的开放一个的阶段一个阶段主要目的就是逐步的安全的向社会开放，让逐渐因为疫苗上来了。所以这个伯尼最后这一段话讲得很清楚。第一，这个病毒就像以后的流感一样，它不会走，但是呢，它会伴随着人类。但是呢，你只要自己保护措施到位每年打个流感针，我们也不是每年打流感针，但是也不是每年都得流感，但是你要小心一点，比如说勤洗手这个不舒服远离人群以及这个咳嗽遮嘴巴这些都是需要的。口罩它没提了。那么同时呢，他也提到了，也就是说，也是加强检测，像流感一样，流感的检测没人知道，其实各个诊所就是各个lab 都在做，每年那么流感也是，那个新冠也是，让可以不断的去检测他说 repeatedly， 也就是重复的检测，你检测过来可以再去检测就是不断的要加强这些措施。所以呢，这样的话呢，疫苗是最关键的，疫苗上去了，那么这样整个社会回归正常。他说零今天没说，他之前就说过零是理想，零是理想，做不到的就是这么回事。那么他现在在说法语，所以我有机会把这个新闻简报一开始报的数字再重复给大家。到目前为止，全省已经有3823103个人接种，其中这个成年人是占到了74.9%，12岁以上的算进去是72.8%，这个接种率很高了。那么昨天24小时里边新增了153例，那么整个省累计到了145996例，其中延安卫生局是新增21例。飞沙卫生局新增73例，岛上卫生局新增11例，内陆卫生局新增39例，北部卫生局新增9例，这样加起来是153例，总数就到了145996例了。目前为止，那么新增是176，住院是176个，其中重症监护的 ICU 的是49例。很遗憾还有4例死亡。那么目前死亡总数，新冠相关的死亡总数就到了1729例。那么各位观众，今天礼拜四他们的新闻简报就为大家做到这儿。同时呢，有一点提醒大家，也就是下星期一会有省长和上面2位给大家做新闻简报，宣布第2阶段实施的一些问题和这个措施，所以欢迎大家到礼拜一再收看我们的节目，也祝大家有一个愉快的、安全的周末。谢谢大家对我的鼓励。